guys, I'm Dr. Erin Stair. I'm the host of the Trial Site News podcast, and we have an amazing guest with us, Dr. Monica Gandhi. Thank you so much. I love your Twitter, by the way. I'm like a huge fan of your work.
Thank you.
Yeah. So
I always put in like definitive ideas.
No,
I have a lot of ideas.
You do.
Yeah.
It's clear that you think for yourself, and it's just it's great. Do you mind just giving kind of like just a brief intro about who you are and what you do?
Yes. So I am an infectious disease doctor, adult ID doctor here at UCSF, and I'm also a professor of medicine. And my main roles are that I direct the HIV clinic here, which is called Ward 86. And I also am the director of the Center for AIDS Research here at UCSF.
So today I wanted to focus on the Delta variant, because obviously everyone's talking about it, kind of Game of Thrones style, right? Like the Delta, instead of winter is coming, it's like the Delta variant is coming. And I know it's here. I think the cases kind of doubled in the last 2 weeks. And then just yesterday, Dr. Fauci said this is going to be the greatest threat to the nation in terms of putting a stop to COVID-19. So can you just briefly, I want to talk to you about kids, but can you just briefly offer your opinion on the Delta variant?
Yeah. So, I haven't been as worried about these variants in the sense that I don't think they're going to evade our immune response, which would really be awful. But I think there are 3 ways to break down what variants could do. One, they can be more transmissible. One, can they be more virulent or, cause more severe disease? And third, can they break through the immunity that we have from the vaccine or even from natural infection, actually? Luckily, Alpha and Delta both are not great, and they both increase transmissibility. They seem to just spread faster. But there's no evidence that I can see that either Alpha or Delta does any of the second two. So in terms of increasing severity of disease, you would have to look at total hospitalizations over case. Like, cases are your denominator and hospitalizations are your numerator. And if our hospitalizations per case, like say, pretend it was like 1 hospitalization for every 2 cases, which it isn't, of course. Then if we suddenly started seeing 2 hospitalizations for every 2 cases, we would know it's more virulent. People needed to be treated in the hospital. But luckily, there is no sign of that actually happening with either the Delta, and it didn't happen with the Alpha. And then the third and the worst case scenario, the worst nightmare that I could ever have, is that it would break through the vaccines. And there isn't actually evidence that the Delta variant is going to break through the vaccines. In fact, there was just breaking news from this morning. Today is what day is it?
I think it's the 23rd, I think.
It's the 23rd of June. And there was breakthrough news from this morning from the Public Health Foundation from England that showed that even 1 dose of the Pfizer vaccine was 94% effective in preventing hospitalizations, just 1 dose. And then 2 doses was 96% effective. So this data is evolving in real time, but these vaccines work. And it actually has to do with what we call T-cell immunity. That, just to put it super simply, say you have a spike protein and there are like 100 little segments of a spike protein, like train tracks. There is a T-cell that can fight 100 segments across the spike protein. It's called epitopes of the spike protein. And if you knock out 13 of your epitopes because you have 13 mutations in the Delta variant, you still have 87 T cells there to protect you. So I don't actually think that it's going to evade our vaccines.
That's good to hear. And those are like really great rates in terms of preventing hospitalizations and stuff like that. I wanted to ask you, I've seen on social media, and obviously the media, it's really hard to kind of, I feel like there's a lot of fear that goes into a lot of reporting and stuff like that.
Yeah.
I think World Health Organization officials yesterday, or was it Monday, they said that it is the fastest and fittest coronavirus strain. And we see that word a lot, like fittest. And I'm sure to kind of like, an average person, they're like, what does that mean? Right. So, because it's kind of like, you kind of have this vision of like, what is a fit virus? And
yes. I know what a fit person looks like, but I don't know about a virus.
What does a fit virus look like? So like, can you explain that in plain language?
Yes. I mean, basically all that means is, what is the smartest thing that an organism can do? It can spread. It can make more copies of itself. That is smart. That's evolutionarily what we're trying to do maybe not us as humans, but just in general, animals trying to make more copies of themselves. And so viruses want to make more copies of themselves. And so what they want to do is they want to evolve in a way so that you can essentially transmit faster, go from person to person to person faster. And so if they latch on more strongly to your cells, then you will make more copies and then you'll spread it more. And so that is really what this means by fit. It's more transmissible. It likes to go from person to person. Now, the more and more of us that become immune, it can't do that. It just can't get to us when we're immune. And there is a certain amount of us who are naturally immune, and it probably can't get to them either for quite a while, for 9 months or longer, because natural immunity also lasts. So we are seeing the cases in the US, despite us having the Delta variant, and even if 20% of the cases that we have left are the Delta, just remember, we are for the first time under 10,000 cases in the US than we've been ever. This 10,000 was this magic number that Dr. Fauci said at one point was going to be his like dream number of control. So cases are still going down, hospitalizations are going down, deaths are still going down. So I want to put this in perspective so that we're not scared in the US. Places that don't have high levels of immunity need the vaccine. And I think that is the most important thing we can think of, is global vaccine equity in all of this.
I totally agree with you 100%. And I think the US is supposed to ship vaccines. I know our government's kind of slow with stuff, but
they've been slow. They were supposed to get 80 million doses out in the next 4 days.
I was in the military. It was like, hurry up and wait, right? That's our phrase for the government. I wanted to ask about kids, because obviously there's all this talk about the Delta variant infecting younger people. You know, they might not have, obviously they don't have a higher vaccination rate that adults do. And I see a lot of stuff, data coming out of the UK. Well, actually, I don't see a lot of data coming out of the UK. I just see a lot of like, it's infecting kids, but I'm always like, well, what are the severity of symptoms? Like, what does that look like? And so can you offer some intel on like, are kids getting really sick with this? Are they ending up in the hospital? Like, what do their symptoms look like?
Right. It's actually, the funny thing is you just repeated the exact same story that was said about Alpha in Michigan. Remember, there was a lot of talk in Michigan that look how sick kids are getting from Alpha. And this is a more virulent virus. That just wasn't true. It was a prediction, but it wasn't true. So it is true that where are the cases of Alpha or Delta now, Alpha then, Delta now, being seen? In those who are unvaccinated, and children are unvaccinated. However, children are 3 times less likely to get any strain, any type of COVID with the same exposure than an adult. Well, that would be Alpha, that would be the ancestral strain, that'd be Delta. And so they're still less likely to get it, and they're less likely to spread it by half. But they are getting it, young people are getting it, but luckily, because they still don't get sick from coronavirus, they are not getting sick, and they're not in higher rates in the hospital. Who's going into the hospital are more the younger people, but not children, but like younger people who still hadn't had an opportunity to get their vaccines, like 40-year-olds, because they did a very deliberate strategy. They gave 1 dose and they were waiting. And they're just, some young people are getting their first dose now. They paused their reopening. They said, let's keep on going with our vaccines and let's give them out faster. And that's great. I think that was smart and to do that. But it's not that children are getting sick. They're not ending up in the hospital. They are spared a lot of the effects of this virus, which is a blessing. And they will ultimately get vaccinated, but the way they're going to be protected until they can get vaccinated is us all getting vaccinated as adults and keeping the rates low.
Thanks for clearing that up, because I know a lot of parents are super worried. And you just said there's no evidence at all that this is more deadly at all.
No, there really isn't. And in fact, there's that ratio. I keep on encouraging people, look at that ratio.
Case fatality.
Hospitalization to cases. It is not going up. In fact, it's actually been going down over time. Why? Because the older people who are more vulnerable have been vaccinated.
I've heard they talk about outbreaks in schools in the UK, and I just read a report in Israel, and they're now talking about school again. And I know, like, we kind of established that schools are not, or school kids were not drivers of this pandemic, right? I know we kind of came to that conclusion maybe later than a couple other countries, but Yeah, but
later, yes.
yeah, but now they're talking about, masking again in schools, like who's going to be vaccinated. Like the kids probably won't, all the kids definitely won't be vaccinated by, the fall. So what are your thoughts on, are you concerned that school children are all of a sudden going to become, drivers of this?
No, I just think that biology means that children are just less from the same exposure, they're less likely to get it. And then even if they get it, they're less likely to spread it by like 50%. So they're 50% less likely to spread it. That has been true of all the variants. So I don't think they're going to become drivers. I think that the adults and teachers and parents are all safe if they get vaccinated. By staying vaccinated, they keep their children safe because the children are mostly around those people that are teachers and their parents. And then in a school building, mitigation procedures have always worked. Where the US went wrong is not putting into place mitigation and just opening our schools faster, which is what Israel and the UK did. They never, bars and restaurants were always last, like schools were always first. And we did it the opposite, and we just did, and we're going to have a reckoning with that. And so at this point, I see no reason to change anything for the fall for our school kids, which a lot of people are saying it should be normal school. In terms of mitigation procedures in schools, I would judge that by community rates in your region. So for example, and actually the CDC is pretty clear on this, and I think they're going to say it in their new school guidance. If you are at the lowest risk of transmission, which is about 5 cases over 100,000, 10 cases over 100,000 cumulatively over 7 days, or a better way to put it is a low test positivity rate. Or even a better way to put it is a hospitalization rate of 5 over 100,000. You're at the lowest risk of transmission in your region. That is likely when the CDC is going to say, we don't need mitigation in schools, because what's keeping kids safe? Low case rate to the community. If there are higher case rates in the community, which will be linked to adults not vaccinating, then there will probably be a metric that the CDC will put in that children have to keep unmasking in schools. So I'm quite positive that just like that the CDC is watching this really closely, and every region is going to be different depending on our vaccination rate. Now, do I think we can get there all places in this country by like August 28th? Yes, I do. I actually think that this kind of myth that we're not doing a good job with vaccination, we may not have gotten 70% to everyone by July 4th, but all over 30-year-olds will be vaccinated 70% first dose by July 4th. That's pretty good, in my opinion.
Right. And the first dose is good, right? Yeah.
It's good. And then college students, they may be waiting until they get to college. They may be like, life is too busy, and life is,
Sure.
like their lives were really hard last year, and maybe their life is opening up, and I think they'll get it. And so I'm not as dismal and down that we're not going to get to the rates we need for full vaccination.
Okay, I know you don't have much time. I only have 2 more questions for you, and I want to thank you for squeezing us in.
Thank you.
Because I know you're busy. So obviously, there was the meeting today about the potential risk of myocarditis, pericarditis, and especially in kids. Oh, there goes my headphones. But are you concerned about that at all? I know the FDA decided to put a warning and say it's rare, but lots of parents are concerned. Lots of parents are like, hey, my kid's healthy. Like, why should I risk it and give them this vaccine, especially if they're not going to have, severe symptoms? And so, I think it's a very common, and some people, I even see some people on Twitter, medical people are like, well, maybe we should only give them 1 dose. What are your thoughts on that?
Yeah, I mean, I actually, I do have thoughts on it. And the way I think about this is, one thing I keep on starting from the principle of is I want us to have good trust in public health, because I think that will decrease vaccine hesitancy. So I think to completely eliminate this concern and say no big deal, I think is not actually the right approach, because these are healthy children. These were cases of myocarditis, and of 323 that they've done a full chart review on, 70% of them actually did have to go to the hospital for a short period of time. So this is, it's rare, it's 12 in 1 million, but it's there, it's real. And it's an increased risk from the expected rate of myocarditis. And it's very specific. It's males, it's and after the second dose and within 4 days of the second dose. So I came up with a recommendation of my own that the FDA
Oh,
will probably
awesome.
not do, but I did write the NIH.
Well, share it, definitely share it.
And I shared it with the CDC and the NIH because it's all going in today. And I just thought I have a good idea about all of this. One is that this is how I would do it. I would say for young men above 18, we can encourage the Johnson & Johnson vaccine between 18 and 30 because the risk went up to age of 30 because the risk of clot is actually in women. So this is the opposite. The risk of myocarditis is in males. So encourage the Johnson & Johnson between 18 and 30. If you're 12 and 18, you have to get Pfizer. It's the only 12 and 17 is the only one approved. And my recommendation is if there are low rates of community transmission, extend the duration between doses to either 8 or 12 weeks. Okay, and why did I say that? Well, this is what I think it's weird, but it's kind of looking epidemiologically. Where we're seeing the myocarditis is in Israel and in the US, where we do 3 weeks between doses. And they haven't been reporting myocarditis in young men from the UK, where they do 12 weeks between doses because they went ahead and did a first dose first strategy. So they were trying to get more doses out. And so it may be something about just we can increase safety by extending the duration between doses and have our efficacy too. So have your cake and eat it too. So I have a whole idea about it. And I actually wrote the CDC, I wrote the NIH, and let's see if they take my recommendation.
That's amazing. I actually have not heard that before. So
I just made it up in the last half an hour because I was watching the data carefully. I was watching the meeting and I was like, you know what? Safety is important. And actually, I want to increase public health trust. I think being more transparent and acknowledging a side effect that doesn't make people want to take the vaccine less. It makes you feel like taken care of, that people are acknowledging safety issues. And when I saw what we did with the Johnson & Johnson, I think acknowledging the clot issue made people have more trust.
I agree with you. And I think kind of like hiding these things actually creates anxiety, and that fuels distrust. So my final question, and this is along the lines of trust. And I work in SciComms too. And I'm always, do you think we're doing a good job communicating about this pandemic? And I think I already know the answer, looking at your expression. But like, what do you like, where do you think we went wrong, and how do you think we can do a better job? And you see it too, there's people who, you know, the blue check mark club, that's not to be like condescending. It's just, you know, there's so many different personalities and political ideologies that go into this. Like, how would you, like, in terms of creating trust in public health systems, again, what would your advice be?
You know, my advice is that if you just tell the data cleanly, simply, and without an agenda, people are not dumb and they will trust you. So what I mean is, we messaged, stay away from each other, just say no, like just stay in your houses. That isn't smart. Like, people needed to see each other. So instead we could have said, hey, here's how to stay safe, mask, distancing, ventilation. But we used sound bites. We were like, just say no, just stay home, just go away. And I think that instead, this is the data. These are the people who are more vulnerable. These are the people who are less vulnerable. Masking works, distancing works, ventilation works. And we could have had more time where people had together, where they didn't feel so lonely and miserable right now. And then now, in terms of public health trust around the vaccines, is kind of what we talked about. It's okay to say if there's a safety concern, and that you are thinking strategically about ways to maximize safety and efficacy at the same time. And I don't know how things are communicated anymore, because yes, people tweet and people will follow them and they'll really trust some people, but then the news will follow whoever they want. And I just think
it seems like a same group of people.
Yeah, like, it's the same people who get to like do all the messaging. And I think maybe a variety of messengers would help. And also just coming out and saying, maybe that just like every day someone could come up, Biden's chief of staff could come out and just give a little update on COVID from what he's heard from the public health officials. This is real, but we're going to do something about it. We're concerned about it too. Delta variants, it looks like it's going to be okay, but we want to get everyone vaccinated. Just say it in a calm voice too.
I don't know if that'll get all the clicks that people want.
I know.
Because fear kind of works for clicking. I mean, even in myself, I'm like, oh, that sounds scary, I'm going to click on it.
I know. And then that's the problem, right? So I don't know. I don't know, but I believe in calmness.
Calmness. Yeah. No, I really respect that approach. Thank you, Dr. Gandhi, for coming on today. And that was great. I learned a lot and I look forward to sharing it with our
Thank you.
viewers. And thank you for all the work you do, and follow her on Twitter, everyone.
Yes, thank you so much. And thanks for
absolutely.
having me. Thank you.
Okay.
Okay,
Bye-bye.
bye.